One is, with all those drugs available to us, which is the optimal first-line treatment? Is it infliximab? Is it Humira? Is it vedolizumab? Is it Stelara now we've got that? Is it going to be one of the new drugs? It's a very complex area. Then what do we do when infliximab fails or Humira fails? Which is our second-line drug, in other words? Or do we escalate the dose or the frequency of infliximab? Do we add in azathioprine? Then there's a challenge about monitoring treatment response and disease progression. So we used to monitor the patient's symptoms and ask them whether they've still got diarrhea or bleeding. Now we have to look at the mucosa and put them through colonoscopies and submit stool samples for calprotectin. And obviously, we are no longer paternalistic with our patients, as they were back in my student days. You do this, you do that. Now it's about engaging with patients so that they are part of the shared care and participate in treatment decisions. So the future of IBD probably rests on combination therapy, and that might be vedolizumab and infliximab, or Humira and some other drug. The earlier we introduce biologics, the more likely we are to halt the disease progression and avoid complications in the future. But in the UK, you have to be pretty sick and earn your expensive drug. So you have to go through years of steroids and azathioprine before you can get onto infliximab, for example. Whereas in the States, they make fun of us because they would introduce it much earlier in the course of disease, unless you've got aggressive disease from the beginning. Strategies to overcome loss of response, I touched on that. What's called treat to target, which means you don't just give every clinic the same thing. You have to look at each individual patient, what their personal, social, schooling, educational needs are, what their mucosal healing looks like, what their drug levels look like, etc., etc. How we can predict response to treatment, and there's also, with all these new drugs, none of them, there are no trials looking at A versus B. There are just a trial of A versus placebo, and B versus placebo, or versus standard treatment, but not head-to-head trials. So that's my half an hour, I think. Sorry, not 20 minutes. Half an hour brief.